Ay, Dios mío, no me llega. COVID pandemics, the disease created by SARS-CoV-2, the new coronavirus. Today, we're going to see many things, the technical reports, some elements that were outstanding. Specifically, the president was asked about Mexican people who have presented COVID-based infection abroad and those who have died, and we have the information from the Secretary Ebrard. We're going to present it, some other details, and the Q&A, and Dr. Alomia is now going to present the report. With your permission, Undersecretary, good afternoon to everyone who have joined us today in this vein, and all those people who are watching us in the different communication outlets. This is day 54 of the national campaign of safe distance, social distancing. This is conference number 77. Now we will proceed to update data, mainly in the international overview. We have the first available slide where we really don't see many changes according to the rates, stability shown in these last days, beyond of what we are still observing, how to contain the pandemics in general, and the cases that have gotten started with symptoms in these last 14 days. We are now approaching only to the fourth portion of active cases, would then constitute the pandemics in general. In the Americas, we are still focusing much of the cases, but proportions have not varied that much in this last week. In this next slide, we updated the figures at a national level, more than 163,600 people going to protocols of laboratory studies. From this number, 89,639 are negative cases when tested on SARS-CoV-2 discarded from disease, and 45,032 individuals were positive to the SARS-CoV-2 test, and that's why they are confirmed cases of COVID-19. From these, 10,238 are those who have gotten started with signs and symptoms in these last 2 weeks. We see that this is less than the fourth portion, representing precisely the active epidemic in Mexico. And from this group of 45,032 people that during all this time were confirmed, 4,767 are demises created by this disease. And in this slide, we see the accrued burden, these 45,000 confirmed cases to SARS-CoV-2, and how the layout goes according to the different states where we have confirmations. And today we see that another state is added up to the other two that we reported yesterday. That is to say, Mexico City and the state of Mexico. Now Baja is also joining this group of states that has confirmed more than 3,000 cases during this epidemic in Mexico. The amount of states that have gone beyond are still in a rate of 65% with no variation, only variations in the inner portion of this percentage. 35.2 would be the accrued incidence per 100,000 inhabitants of epidemic in Mexico. This next slide would be a little bit more illustrative in order for us to identify swiftly Baja California, that is appearing with this color representing above 3,000, and these are 3,040 cases accrued up to now. The next slide, we can see the recent epidemic in Mexico, the 10,238 active confirmed cases. We get to see here less states that would be in red representing that barrier of 500 cases up or down, but as long as the epidemic is in evolution in Mexico, we will get to see changes in the colors of the map. In this next slide, we can get to see the same information, but also in descending order for us to identify very quickly those states that are more active, since this is the amount of cases with initial symptoms in these last 14 days would be representing also the states where we have more active transmission activity. In this next slide, that is the one that is distributing according to incidence rate accrued to the cases. According to this next slide map, this is where we can actually get to compare the greatest transmission in the community, because the states that are in darker green, the incidence rate would be the highest according to these last 14 days and presenting this characteristic. Basically, we have the two that would be above 20 per 100,000 states, Tabasco and Mexico City. This next slide is showing us information also distributed in descending order, identifying Mexico City and Tabasco as the states with the greatest rate of incidence, followed by other 5 states that would be sharing similar rates. In this next slide, we are going to see how the distribution is according to a current state, where we had the unfortunate demise of these 4,767 people because they got sick of COVID-19 confirmed in laboratory. These people were indeed and effectively positive in SARS-CoV-2 testing, and in light orange, we see those people who are still awaiting for results, these dead individuals that are to be sorted. We see the addition in dark blue and the light orange. We can get to see the stable trend with those people with laboratory testing that have already received a result or expecting one, at least in these last 2 weeks, not as it would be prior to 1st of May, where we saw an ascending trend in these demises aspect. And we are now going to see the distribution according to the state where they were receiving medical care and where they actually passed away. And as the light orange bars are indicating the possibility or expectation of getting even more demises or confirming even more demises of the ones that have already occurred. And in this next slide, we are going to see the epidemic curve, cases that have been confirmed, cases that are under suspicion, and we see the ascending trend. And in this case, we can also supplement that 52%, that is to say more than the half of these suspicious cases. These are still pertaining to Mexico City and the state of Mexico. That is precisely the composite of Mexico. More than half of these suspicious cases at a national level are concentrated here, and this is pursuant to the fact as of today and also the previous days and the days that are upcoming next week, we are in the Valley of Mexico in this season where we had the greatest intensity and load. And this is also going hand in hand with the information that we are obtaining. That is to say, we increase the notification of suspicious. That is why we have a great amount of them on this report. And in the next slide, we are going to see the accrued burden confirmed cases, 2,437. The second day with this same behavior in the last 24 hours, representing 5.7% of increase according to the accrued burden of cases reported yesterday. We can see that in the orange bars in the lower portion of the slide. In these last 2 days, we've had that same amount confirmed in these last 24 hours. And these are of the greatest burden in 24 hours we've had if we compare to the previous bars. Now, let's go to the availability and the occupancy in hospitals, 96% is about the notification rate of the 732 hospitals that are included that would have a user and password in order to log in and upload information. 705 did it in the balance yesterday. And that what's what we were told, that at a national level there were 14,408 available beds for respiratory acute and severe disease. But also we were informed that 8,233 beds of these general respiratory attention were occupied. So we have a 36% occupancy. Yesterday was less, it was increased 2% at a national level in terms of occupation. In this next slide, we're going to see the layout of this 36%. It is at the end in the national bar aspect, but we can also see the states like Mexico City, the state of Mexico, Baja California, Veracruz, and Tabasco, Sinaloa still are still above the 40% of occupancy. And in this next slide, we are going to see specifically occupancy of beds in intensive therapy with mechanical ventilator for critical patients. 30% is the occupancy at a national level, with a good availability at a national level as well. But when we can get to see by states, we see that Mexico City, Sinaloa, the state of Mexico, Baja, are the ones that would have not much of this availability, with 63, 59, and 55 respectively. And these are the states that in these last days, practically 2 weeks, we've been orienting the support, the assistance, along with resources, not only input and equipment in order to transform these hospitals so this occupancy level and or availability would reach saturation generation. And the state is also receiving human resources in order to keep up this availability that is quite necessary. And this exercise would also be conducted with any of the other states that at a certain point of the epidemic would require this kind of support in order to have available beds for those who are requiring it the most. In these other 3 slides, we want to show you information in relation to the diagnose on laboratory testing and base, and that we've seen as something that we've revealed in different conferences that is also constant in the questions. And that's why we're going to present this information, and we're going to update it on a weekly basis for you to keep them. In here, we are showing you the samples of a laboratory that up to now have been processed for identifying SARS-CoV-2 in Mexico. And these are 128, 253 tests being conducted according to our balance from yesterday throughout Mexico as a whole. And this is the distribution since we got started testing since January and until balance from yesterday, how process came day by day, and how this increase is basically getting started between March 11 and 15. And since that increase, the trend has been completely ascending, where these tests have been conducted. And this trend precisely is given hand in hand with demand, as it has been commented before in other previous conferences. It is not that we can schedule and say, well, this week I'm going to conduct 500 or 1,000 tests. Tests are being conducted according to demand. If we have symptoms and signs in a patient, they pull into a unit. It is suspicious case in that moment, and according to the protocol, the test is applied according to demand. We give the test. 70,800 109 tests in the state network of laboratories, 71 throughout Mexico, plus the metropolitan laboratory pertaining to Mexico City, as well as the laboratories that are now assisting to epidemiological surveillance. These are laboratories pertaining to concentrating hospitals, also 5. We have here great hospitals concentrating regionally 50,775 tests, and the difference when adding them up is not going to give 128,000. The difference are the processed tests directly gone to the reference of epidemiological control center, and this processing is now giving distribution to throughout the network, the state laboratories, 101,900 tests that would allow logically to keep up with this surveillance of the behavior of the epidemic. And 8 days ago, we conducted the purchase and the acquisition by projecting the needs that we are going to get into the next few weeks. We have already paid out with the funding of INSABI, that is also doing this for testing to reach all the states, the purchase of 300,000 tests that are going to be added up to these 101,900 that we have in order to keep up with our surveillance on the epidemic in Mexico. In this next slide, we're going to see the behavior of the positivity according to the process test. We have a distribution per epidemiological week. The numbers that you see here are the weeks, epidemiological weeks, 7 days from Sunday to Saturday. We are closing week number 19. That's why we see that this is having the list of tests processed, and we also see the tests that were outstanding. And if you remember the chart where we were showing confirmed cases with the red colors and the cases that are still outstanding for confirmation, light orange based colors, these have been distributed in these last 2 weeks. And this is because patients, whenever demanding medical care, maybe they have 3 or 5 days with symptoms, they are taken the sample, and the samples taken in these last 3 days would represent patients that got started with their symptoms since last week. So that's why you see that the percentage of positivity pertaining to week 18 and week 19 would be below week 17. And due to this previous comment about the initial symptoms, the date where the patient is demanding attention, the moment in which the sample is taken and processed, week 18 and 19 are still under construction. We're going to get them finally with when all those light orange bars would then actually get a result. So we are waiting for these 22 and 26 to be increased at least to a 36 or even beyond that. But if we see the weeks that have been fully processed, you can see that the ascending trend week by week, and in relation to the amount of tests that have also been taken, we see an increase up to 36%. In a national level, there are entities that would be above that 36 and entities with low transmission that would be even below the 30%, 36%. In this next slide, we want to show you a piece of data that we are showing for the first time once it has been validated and also issued officially, not because INDRE is processing tests, but because INDRE is the agency, ruling agency, giving the notifications of positive results coming from private laboratories. All these private laboratories where INDRE conducted some appraisal and then given the possibility of being certified because of this reactive or KIT as with a confirmation status after the corresponding process, receiving 16,500 650 positive cases from this source, but we want to be very accurate in this case because I'm saying positive results and I'm not saying cases or confirmed patients as we would say with the aforementioned statistics, because these are positive results. Laboratories, clinical laboratories not pertaining to any hospital would not go through a medical care process. That's why they would not keep record about the information of that person or pathology, symptoms, initial date, or evolution of the patient. They would just take the sample, process it, and issue some results. So in this group of 16,450 positive results, and as a fact, we can see that related to the percentage of positivity, which is 23% in laboratories of the private realm. And this is what we are seeing with difference of public laboratories. And that is one of the reasons we cannot just add up these 16,450 results to the statistic of the 45,000 already confirmed cases, because in these results we have many people that would just be transmitters. They are not declared cases, and since this is a private laboratory, they paid out for it, they received their result, but not necessarily presenting symptoms, and this could explain why the percentage of positivity would be less than the 23%. Another important point for us to avoid direct addition is because it is not a nominal result. As of now, we don't have the full name of the person with these results, and it is possible that this person could have a result in another nominal and result where he or she demanded medical care, and now it is ready for next week's operation. Within the surveillance components, we are integrating an online module for all these private laboratories that are still going to conduct studies. Will then be able to record the minimum pieces of data identifying that individual, saying at least if they had the symptoms, in order to increase the amount of bearers, and then getting the proper information that would then be uploaded to the official statistic with the distributions according to municipalities or gender. There are other laboratories that also were validated by INDRE, the laboratories from the academy, other public hospitals that are just regular operating ones, where we can get to see less amount of processed tests with more research purposes. And that's why in this another group of tests being obtained, we have the clinical inclusion, and we are going to update this information with two other previous the slides for you to always have the information at LDO. Thank you. Thank you, Jose Luis Salomia, General Director of Epidemiology in the Ministry of Health. Now we are going to comment very briefly two elements that were questions yesterday and this morning to the President in daily press conference. The first one is how many people of Mexican nationality have been suffering or have been identified with COVID abroad, and how many have passed away. I am very thankful to Minister Marcelo Ebrard, and also I take great pride in our Mexican foreign service that is updating this statistic as a way to give protection to our partners in other parts of the world. And we have here two people infected with the virus in the US, and also we have the people who have passed away in the US because of the disease, and also for those who were having conditions somewhere else in another country. due to our intense exchange of information with the US, we can get by a state from the United States the number of Mexican citizens suffering from COVID and that have been reported by the foreign Mexican service. And we have the total in states, the total of people that the government in the US or the corresponding state governments have reported COVID cases independently of their nationality. The addition of total cases of COVID in every state pertaining to the country United States of America, just as a reference of the quantity, it is possible that in some cases and within these totals we have also people from Mexico, and it could happen like anywhere around the world. There are cases that go unregistered, not contained in the inner recording. So we can anyway compare it. And that's how we can get to see the additions, 337 Mexican citizens suffering from COVID, and they are residing in the US, and the total figure of people informed by the US, 1,800,000 registered in this country with a population of a little bit more than 300 million inhabitants. This is the case of people who unfortunately lost their lives, and they are Mexicans. And we also have, according to the states, the same logic. Those Mexican people and also the deaths that have been reported in the corresponding states. We have inclusion of Mexican people here, but as it happens anywhere around the world, we have a rate of deaths that are not directly recorded in their own countries. In the US, we have a very similar processing to what Mexico does based on the studies made in order to analyze before giving a death certificate and the period of 2 years that is given by the official statistics agency. 300 and people died. Well, this question that you are now making, and just as it happens with Mexico, in the US and practically the rest of the countries, we are not following the same logic for recording cases and recording deaths. And it is not uncommon to see that deaths and severe cases is not that scrupulous. And that's what we've been saying for our statistics in Mexico. It would not be that strange that we have a more robust statistic for deaths due to the paperwork and the certificate requirement that cases, 827 people, not necessarily corresponding one-to-one. If we go back a little bit on the slides, this doesn't mean that these 337 individuals are necessarily the ones who died and also recorded in the figure. Maybe some of these people would be included in those who died. And in the next slide, some of these 827 people were not recorded in the first place, say case. And it is a very good observation. And in the US, we've seen 75,777 people died to the official registration kept by the US, that just as it would happen in Mexico or any other country around the world, we'll get to know the real figure whenever analysis takes in place with a very similar methodology shared by many countries. The post-analysis 2 or 3 years afterwards on behalf of the statistics given by the agency issuing death certificates. And that's where we will see the mortality rates in the US and the rest of the countries with these systems that are comparable. Now we're going to see how our Mexican partners are doing. And if we go back, we can see that in the state of New York, it is not only New York, it is also including in this case Connecticut and also the counties of New Jersey that are the metropolitan area of New York. We have 594 people, and they are from Mexican.
Finalmente, de este informe tenemos contagios y defunciones, enfermedad COVID en personas mexicanas fuera de los Estados Unidos.
Here we can see Mexicans outside of the United States, but who are registered in our foreign registry as living outside of Mexico. Here we can see the number of cases. We see contagion on one side and deaths on the other. So we have 61 Mexicans who have been registered as having COVID, and 4 who we've received notification of their death, and that is of 95,597 people total who are in the United States. Take a look here and you can see that the countries over here are the same. They're the same on both graphs. Something else that the president was asked this morning, I wanted to present it here so that people can be a little bit more familiar with this information. And that is the safe recollection of biological waste that could potentially infect other people. This is how it's defined: managing biological infectious disease residue. This is a technical definition. In Mexico, we have 2 official standards that speak to this. We have standard 087, and then we also have 045. One of them is the Secretary of Natural Resources and the Environment and the Secretary of Health with COFEPRIS, which is the equivalent of the FDA in the United States. Standard number 87 is for environmental protection, and then number 045 is for epidemiological monitoring and for preventing and controlling infectious diseases that are related to health. We would like, here we identify an organism that could infect other people. This is a pretty vague and broad definition, but it really tries to cover a wide spectrum of living organisms, or not living, because viruses in their essence are actually not alive. They are particulates that duplicate, particles that duplicate and create more disease. When we're talking about dangerous material, we have a framework for identifying whether it could cause more diseases and more contagion. So any materials that are used in terms of needles, gases, compresses, or other types of textiles, for example, liquids coming from patients who have been infected that perhaps could have leaked out of people. We have a list here, and this is how we identify what we're going to do with these dangerous residues, with these dangerous materials. How we're going to transport them. We have specialized companies that are hired by public institutions in order to deal with this dangerous waste that has biological infectious diseases in it. And so we also have guidelines for how we will be disposing of that. This type of material, a couple of things about this. See this symbol here. This is the universal symbol for biological
causantes de enfermedad.
dangerous
Siempre que
waste
vean
that
esto,
cause
habla de
diseases. Whenever
riesgo
you
biológico.
see this,
Riesgo
this
biológico.
is
Cuando
talking
vean
about
este
a
signo, que
biological
parece como
risk.
un cangrejo
This
con un
looks like
montón de
a sort
círculos,
of a crab with a
es
couple of circles on
peligro
it.
biológico.
This is biological
Este tipo
danger.
de material son cajas especializadas,
These
casi
types
siempre son
of
de este
boxes,
color,
these are
rojas con
specialized. They're
la
usually
cobertura
always
transparente
red and
a
they
fin de
have a
poder ver
transparent
o
top so
apreciar si la
that
caja se
people
encuentra
can
llena.
see if
Son
it's
de un
full or
material
not. This
físicamente
this also has to
robusto,
do with
generalmente son de un
with
material
dangerous
plástico,
material,
también
but
las hay
this
de otros
plastic
tipos de
container
materiales
is very
de
strong.
cartón con
We also
características
have some
peculiares
that
de
are made of
resistencia, y este es el tipo de
cardboard that have
caja en la
special
que se ponen
resistant
los objetos
elements to them.
punzocortantes que se
This is where we
utilizan en
put
el tratamiento de
uh,
personas y que generalmente son
things
residuos
that could harm
peligrosos biológico
people
infecciosos. Finalmente se
because it's
sellan y cuando se
biologically
llena hasta
infectious
el
material.
80% de su
It
capacidad, nunca
gets
hay que rebasar
sealed when it gets
esta
up to
capacidad
80%
y se
capacity,
ponen en una disposición
and
temporal
then it is put it
en los
into a
espacios
location
destinados para ese
where it
propósito en
has
las unidades de
been
salud. Un
earmarked at a
elemento que es un
health
estándar que además está
facility
definido en
so
las
that people
normas
can pick
que
that up.
hemos mencionado,
And in our
es la
standards that we
ruta de
mentioned,
recolección de
we
los
also
residuos
have a
peligrosos
specific route for
biológico-infecciosos. Llevan
people
una ruta muy
picking up
específica, no pueden
biologically
estarse
dangerous
trasegando
material.
por las unidades de salud, excepto
So
con el propósito de ser
here our
concentrados en el
goal
sitio específico
is
para ello
to
y
have
ser
this material
posteriormente
specifically
recolectados
where it
por
can
las
be
empresas
marked as
especializadas
not
en el
getting
campo.
confused with anything
La
else
siguiente y
and
última,
be
ya
directly
esta es la
picked
última.
up by those transporters who will dispose of it.
¿Esto es todo? Perfecto. Entonces ahí está la respuesta. Este es el
Thank you.
procedimiento
So there's your
estándar que
answer.
se debe
This is
seguir
our standard
para
procedure
evitar
that must be followed in order
contaminación
to avoid
por cualquier agente infeccioso,
contaminating
no solo COVID, sino
anyone,
cualquier agente infeccioso.
and not just
Muy bien,
not
pues vamos
anyone, but
aquí
any
a preguntas y
infectious disease
respuestas. ¿Qué
such as
quedó
COVID
pendiente
or
ayer?
other ones as
Y luego
well.
nos vamos por
Let's
acá.
move on to
Dulce,
Q&A. We'll go to you, Dulce,
Araceli,
and then you, Araceli. You'll
y
be next.
seguimos con usted.
Gracias. Buenas tardes,
Thank
Liliana
you.
Noble,
Good
profesora
afternoon,
Noble. Tengo
Liliana
dos preguntas
Noble.
y una
I
petición, si me
have
lo
two
permite, doctor.
questions.
Gatel, quisiera saber
Dr. Gattel, I
cuáles
would
serían
really
estas
like to
5
know
acciones que no
what are the
deberíamos de
5
perder de
actions
vista a
that
partir
we
del
must
1 de
not
junio
forget about
con la
until
intención de evitar
June
el
1st
contagio
in
y
order
hacer
to
un rebrote.
avoid
Si nos
contagion
pudiera
and a
ejemplificar
resurgence
de
of
forma
COVID?
rápida,
Could you give
pensando
us
en que
some
se vuelvan
examples of
estilos de
those?
vida, modos
And could you think about
de
people's
vida de aquí
lifestyles
a que
and
no haya
how
una
they
vacuna, ¿no?
lived
Mi
and
segunda
how they
pregunta es para el
live?
doctor
Because we
Alomía.
know there
Doctor
isn't a
Alomía, ¿cómo
vaccination yet.
diagnosticamos a un paciente
Dr. Alomia,
asintomático y
question for
si este
you. How do you
paciente que no tiene
diagnose a
síntomas
patient who is
pudiera
asymptomatic?
contaminar a
If they
alguien más que
don't
estuviera
have
cerca de
symptoms,
él?
if they aren't
Y mi
exhibiting
tercera, bueno, la
symptoms, how do
tercera,
you
más
tell?
bien
How
una
do you
petición,
diagnose
quisiera
them?
saber si hay
And then I
probabilidades
also
de
have
que más
something to
adelante nos
ask
traigan a un
you.
experto para que nos
Could you
platique
also
sobre
bring
todos
in
estos
an expert to talk to
efectos
us
post-COVID de
about
las personas que después ya
the
van a requerir de
effects of
terapia
COVID on
pulmonar o
people who are going to
cardiopulmonar
need
tan
lung
importante?
therapy
Y no sé
or
si están
cardio
pensando en hacer algún tipo
pulmonary
de centro
therapy?
especializado
Are you
para
going
darle
to have a
atención a todos estos
specialized
pacientes. Gracias.
center for
Muchas
these
gracias por
patients?
las
Thank you.
preguntas. Son
Thank you
muy
very much for the
pertinentes
questions.
y
Those are very
particularmente
topical,
en estos momentos.
especially
La
right now.
nueva normalidad, cuando
Our
transitemos hacia la nueva
new
normalidad,
normal, when we transition
vamos
into
a
our new normal,
incorporar o
here's what
debemos
we're going to
incorporar
do.
justamente las
We
lecciones
should
aprendidas de una
include the
experiencia
lessons that we have
intensa en
learned
términos
from
de
this
las
intense
amenazas hacia la salud
experience in
que
terms of the
representa
threat
una
to
epidemia
public
como
health
esta, una
that a
pandemia que ha
pandemic
representado
this
una amenaza
represents.
para la salud
This has been a
en
threat to
todos los
health, public
países.
health, in every
Entonces,
country.
consideramos que es muy pertinente
So
que
we think that
incorporemos
it's
en esa nueva
important for
normalidad
us to
una
include
serie
in
de
our new normal
conductas, de actitudes respecto a
some
la prevención
guidelines
en
around
múltiples
attitudes
aspectos.
and
Ya tendremos
behaviors.
oportunidad, creo
We'll
que será
have an
más pertinente
opportunity. I think
señalarlo
it's
conforme
more
se vaya
important to
disminuyendo
talk
la intensidad
about
de
this
transmisión,
once
los
the
cambios
intensity of
en el
transmission, the
estilo de vida
transmission rate has gone down,
relacionados
and be
con la
talking about
prevención de
how
las
we change our
enfermedades crónicas,
lifestyles and how we
la
focus on
diabetes, la
preventing
obesidad, la
chronic
hipertensión,
diseases
que
like
tienen que ver, como lo
diabetes,
hemos dicho
high
en
blood
innumerables
pressure,
ocasiones,
and
con
these risk
los
factors, which
hábitos
we've
de vida,
said
en
many
particular
times have
los
to do with
malos hábitos
lifestyle
de
habits, in
alimentación, pero ya
particular
hablaremos de eso en
poor
su momento.
food
Ahorita los
habits, poor
referimos
habits
directamente
around
a la
food.
prevención de
We need to really
infección de una
highlight
enfermedad que se transmite por vía
prevention,
respiratoria,
especially
incluyen
for
precisamente los que
diseases
hemos
that are
recomendado desde
transmitted
el inicio
through
de la
your
epidemia, no solo
airway.
durante la Jornada
From the
Nacional
beginning of
de
our
Sana
pandemic,
Distancia,
we've talked
sino desde
about
el inicio.
this,
Enumeraré
not just
algunos,
since the
no sé si
beginning of our
me voy a acordar de
Susanna
los 5,
Safe
pero
Distance campaign.
el lavado de manos
washing your
primer lugar
hands.
destacado,
Washing your
porque el
hands. It's
lavado de
not
manos es
one
un
that we want to
mecanismo muy
highlight on the
efectivo
list. This is an
prevenir
extremely
enfermedades
effective
infecciosas, no
way to
solamente
prevent
COVID
infectious diseases from
y las que
spreading,
se transmiten por
not
vía
just
respiratoria,
COVID,
sino una
any
gran cantidad
disease
de
that is
otras
transmitted
infecciones
through your
que se pueden
airway. And there
transmitir,
are
por
numerous
ejemplo,
other
por
infections like this.
alimentos
For
y
example,
también incluso
there are other
cuidado de
infections like this, and
heridas,
they can be
por ejemplo,
transmitted
heridas que
by
se
different
transmiten por
ways, like
otras vías.
through
Entonces, lavarse
food
las manos es
or
una
through
excelente
other
práctica
manners. So
de
other ways.
prevención
So
de
washing
enfermedades
your hands
infecciosas.
is a really good way to
Otra
prevent
importante
getting
es la
infected
protección
with
del estornudo.
infectious diseases.
Esta protección del estornudo
Number two is about
quizá
sneezing.
podría parecer una contribución menor, pero en la
Perhaps this
medida que se
seems
incorpore como una
minor,
práctica
but if
común
we all
en
do
personas
this
adultas,
all the
en
time,
niños también,
especially
hasta
in
donde
people
logra
who are
uno
older,
cambiar
and
los hábitos,
especially in children,
es muy importante.
we have to focus on these
Generalmente el
habits and
estornudo
focus on healthy
en algunas
habits.
culturas,
So
yo diría que
sneezing
la
in
mexicana
some
es común,
cultures, I would
se
say
protege, se
in the
tapa el
Mexican
estornudo y la
culture,
tos,
you
pero
cover
es
it,
muy común que se
coughing,
utilicen las
and
manos
you cover
y al
coughing and
hacerlo,
sneezing,
estas
and you
manos
usually use your
reciben
hands,
los
and your
materiales,
hands
es decir,
then
las
receive
secreciones, los
that
líquidos
those
que son
secretions and that
precisamente
liquid that is exactly
peligrosos
what
biológico-infecciosos,
is
es como lo
dangerous
acabamos de
because it's
decir.
a biologically
Y
dangerous
la
infectious
mecánica es
disease.
yo me estornudo en la
And
mano
so
o
what
me toso en
happens
la
is I
mano
sneeze on my
y esa mano
hand,
se la doy a alguien para
and then I go to
saludarle,
shake
ese
someone's
alguien la
hand to
recibe en su
greet
mano
them. And if
y
someone greets me
posteriormente
with their
se talla
hand,
los ojos
and
o
then
se
they go
toca la
and put
nariz o
their
se toca la boca,
hands in
es un
their
medio
eyes or they
bastante
touch their nose or
eficiente de
mouth, that's a very
control.
efficient
¿Qué
way
hay que hacer?
to get
Evitar el uso de las
infected.
manos.
What can we
Si es
do? Stop
posible tener
using
un
your
pañuelo
hands. If
desechable,
it's possible to have a
tirarlo
throwaway
inmediatamente,
Kleenex, for
o bien si
example,
no es
and you
posible, si
use
uno
that
le
and throw it away
sorprende
right
la
away. And if
necesidad de
that's
estornudar
not
o de toser
possible, I
sin esos
understand that people
elementos,
have to sneeze or cough and they don't
achú,
have a Kleenex.
taparse
Sneeze
con
into your
el
elbow.
codo.
Okay, cover your
Una
mouth with
tercera
your
que es muy
elbow.
importante es la sana
And the
distancia.
third thing
Eso
that is
hemos dicho
important
que
is
también
safe
puede ser un
distance.
reto porque la
This
manera en
can
que
be
nos
a
saludamos, la
challenge
manera en
because
que
we usually
interactuamos
greet each other
socialmente
and
unos
interact
con
with each
otros
other
está
being
determinada
closer to
culturalmente
each other. And this
y
is
los
cultural.
elementos de la cultura
And
determinan
we
nuestra
know that
percepción del
culture
espacio
really
físico.
affects our
Cuando
perception of physical
inventamos su sana
space.
distancia, el
When
doctor
we
Ricardo
brought
Cortés
out
Alcalá, director de
Susanna's safe
promoción de la salud,
distance,
que
Dr.
fue el
Alcalá, the
inventor de la
health
sana
promoter,
distancia,
he
vino
invented
aquí
Susanna's
y nos
safe distance.
explicó
He
que el
came here
espacio
and he
íntimo,
explained to us
el
that this
espacio
intimate
social
space that we
y el
have
espacio
is
público.
right near us,
Y
and then
estos
we
son las
have a
distintas distancias que en una
social area,
cultura
and then we have a public area.
determinan qué tan
And these are the
próximos podemos estar
distances
unos de
in each
otros y que
culture
eso sea
that dictate
reconocido
how
como
close we
aceptable en
can
la
be
vida
to
cotidiana
people.
para distintos propósitos. Obviamente
And
la
this is
cercanía
for different reasons, you know,
mayor
sometimes
o menor
closeness, the greater
tiene distintos
closeness,
propósitos.
well, it's for
Y
certain purposes.
a lo que voy es que en términos de
So what I'm
prevención
getting at here
sería
is that in terms of
deseable que
prevention,
incorporáramos
what
una
would be great
mayor
is if we
distanciamiento,
could
que en nuestra vida
be
cotidiana
further apart
mantengamos
from each other. And
sanas
this is during
distancias.
our daily lives. We
Una
need to
cuarta
keep
que
that healthy
destaco es
distance.
la
Number four
responsabilidad y solidaridad con otras
is
personas
our
en la medida en que
responsibility
tengamos
and
síntomas. Esto
solidarity to
aplica,
other
por ejemplo,
people.
para cada temporada
So,
de
for
influenza,
example, for
de
every
octubre a
single
marzo,
flu
si tenemos
season from
síntomas
October to
que
March,
nos hacen
if we are
sospechar que tenemos una
exhibiting
infección
symptoms
respiratoria,
and we
los síntomas
suspect that we
clásicos
have a
son
respiratory disease,
estornudos,
and we have
escurrimiento
these
nasal,
symptoms that are
tos,
coughing,
dolor de
runny
garganta,
nose,
fiebre.
your throat
Y
hurts, you
si
have a
tenemos esos,
fever, if we
abstenernos de
are
salir
exhibiting
al
any
espacio
of
público.
those symptoms, then we do
Abstenernos de salir
not
al
go
espacio
out in
público.
public. We
Yo
cannot
diría que
go out
son
in
las
public.
mayormente útiles.
Those are the
Y
most
puede haber otras
useful
auxiliares.
measures. There can be others
Voy a
that can back those up.
plantear el uso de
And
cubrebocas
I
como
must
una
say
medida
that
auxiliar.
wearing a
Como lo he
face
dicho en
mask,
innumerables
it's
ocasiones, yo no
auxiliary.
soy
I've
enemigo
said
de los
this many
cubrebocas, como
times.
se me ha
I'm
querido
not
ver. Lo
against
único que
face
digo es una
masks.
medida
But what
auxiliar,
I'm saying is that
complementaria.
it's an
Su
auxiliary
efectividad
measure. It's
en el uso ya
complementary.
real
Its,
en comunidad no está
efficacy
totalmente
in the
demostrado
community has
como
not
un
totally
mecanismo
been
de gran
demonstrated
utilidad,
as
aunque es
a highly
potencialmente útil.
useful mechanism for halting
Sí, en
contagion.
relación a la otra pregunta,
Yes,
comentar que
and
sí,
with regard to your other
efectivamente,
question,
poder diagnosticar a una
being able
persona
to
sintomática
diagnose someone
es
who
un
is
reto. De hecho,
asymptomatic, it's quite
podríamos
challenging.
decir que más bien el
In
poder
fact, we
identificar
could
la
say that
presencia
just
de
being able to
SARS-CoV-2, el
identify
nuevo
the
virus
fact
en
that
una persona,
SARS-CoV-2,
se
the novel
considera más bien un
coronavirus, is
hallazgo,
present,
porque
it's more like
precisamente
a
si partimos
finding.
del hecho de que la
Because
persona
if
es
we think that
asintomática
this
y nos
person is
vamos al
asymptomatic
procedimiento
and
de
then we
atención
say,
médica y del
okay, how are we going
diagnóstico,
to attend
tanto
them
clínico como por
and how are we going to
laboratorio,
diagnose them
normalmente
in
la
a
persona
hospital and clinic, Normally, somebody needs medical attention because they have a symptom. They're exhibiting symptoms like they feel poorly, they have a fever, and then these symptoms start to be exhibited more strongly, and that's why they seek medical attention. So people who are asymptomatic usually don't go to get health care. So we have mentioned that numerous people who have been confirmed to have SARS-CoV-2 and asymptomatic, those are people who have been asking for the test personally themselves, and they've done it at a private lab. That doesn't mean that some people who are asymptomatic are not carriers. Yes, they are. They have the virus within their airway, but they haven't developed the disease. They have the disease, but they haven't developed it. And we've been looking worldwide about how they're dealing with these asymptomatic people, and we see that there are a lot. But if we relate that to the second part of your question, well, can those people transmit the virus? Well, the risk of transmission from people who are asymptomatic is not as high as getting the virus from someone who is clearly showing symptoms of it, because the virus is transmitted by these little droplets. And obviously, when we sneeze or cough, they're transmitted at a very high speed and intensity. So that force that comes out of your lungs in order to push out those drops that have the virus within them, if you're at a healthy difference from that person, that is to say you're not in their personal space, then, well, if you're not in personal space and you're observing the safe distance, then you're at a higher, you're probably not going to get it because you're not in their personal space. Because we really need to be within that very personal space bubble in order to have that higher probability of being infected by someone who is symptomatic. Because even if they are sneezing, if we're at a safe distance, we might not get infected. And so, should people who have enough money to get the test get tested? Well, the usefulness of taking the test in that way, it has to do with what actions you're taking in order to take care of your health. If I'm asymptomatic, if I'm not exhibiting symptoms, why would I invest or spend money to get tested? Because the private tests are expensive. So if I'm not exhibiting symptoms, why would I get tested? But if I am, for example, asymptomatic and I do get tested and then I'm negative, that doesn't ensure that I am going to remain that way for the next weeks, because at any point I could be infected. So I think that's
Gracias,
unnecessary spending there.
Araceli,
Thank you,
Dulce,
Araceli,
Bianca.
Dulce, Bianca, Angelica.
Nos quedan 10 minutos.
We have 10 minutes left.
Gracias.
Thank you.
Preguntarle sobre las pruebas, la suma
I'd like
que
to
han
ask you
comentado
about testing.
de las tres las realizadas,
Now,
las
the
laboratorios
testing that
parciales
they've
y las
done so
pruebas realizadas,
far
si yo
at
sumo
state
todas esas,
labs, if
me
I
tiene que dar
add
la
that all
cantidad de
together,
las
will
pruebas
that
que se han
give me the
realizado,
number of
de qué
tests that
fecha
have
a qué
been
fecha.
done
La
from what
misma
date to what
pregunta
date?
para las
And my
defunciones que
same
mostraron las
question about
gráficas,
that are
de
deaths,
qué
the
fecha a
deaths
qué
that you
fecha,
showed, from
estos
what date to what date are they?
337
Those
mexicanos con COVID,
370
qué
Mexicans
fechas
with COVID,
abarcan desde que
what
nosotros iniciamos,
dates
que
do
sería el
those
28 de
represent? Is
febrero,
that
o
from
desde qué
starting in
fecha está
February,
anunciando
or
el
what
gobierno
dates are you
estadounidense
talking
que se
about
registra
there?
este número
And
de fechas.
what dates is
¿Cuánto dura
the
el
United
virus en una
States
persona
talking about there?
asintomática?
And
Puede
now,
durar
an
más
asymptomatic
en una
person,
persona
how
que tiene
long would the
síntomas.
disease
Y por
last
último,
in that
doctor,
person?
recordarle
Longer than someone who
que
is
nos
symptomatic?
prometió una
And also,
sesión
doctor,
que
to
hablara
remind you that
sobre
you
la inmunidad de
promised a
rebaño.
session that you would talk
Entonces,
to
esto
us
es
about
como muy
herd
importante por este
immunity.
rumor que se ha
That's
estado
very
generando
important
de
because there's
las
been
fiestas para que
a
la gente se
rumor
convoque,
running
trabaje y todo esto.
around
Siento que es un tema
about
coral,
herd
ojalá pueda ser
immunity.
un
So
espacio en su agenda
please,
para
maybe you
poder
could
subir
make a
ese tema.
space in
Gracias.
your agenda
Muchas
to
gracias.
explain
Mañana
herd
mismo,
immunity to us. Tomorrow.
para que yo
Tomorrow
tener
I'm
la
going to
ocasión
explain
de
that to you.
dejarlo claro sobre
So
este
I will
tema
be
de
very
los
clear about
audios de
herd
los rumores,
immunity,
pero
and I will
mañana,
be
que es
clear about the
sábado,
rumors,
dediquemos
and I will
el
do that
tiempo a
tomorrow.
hablar de inmunidad rebaño. Para la ciudadanía, quizás se han
To our
encontrado con un audio
citizens,
donde se
perhaps
escucha
you
una
have
voz
heard
femenina
an
aparentemente de
audio
una persona
recording
joven
where a
con
woman's voice, a young woman,
cierto acento
talks,
posiblemente
and
de
she
la
has a sort
Ciudad
of
de
an
México
accent. Perhaps
que
it's a city of
pareciera
Mexico,
invitar
Mexico
a
City
una fiesta en
accent,
un
and she's being
predio
inviting
en la
to,
zona
she's
occidental de la
inviting
Ciudad
you
de
to
México,
a
concretamente en la
party
colonia
in
Las
the
Águilas,
western
alcaldía
area
de
in the
Álvaro Obregón,
neighborhood Las
y está
Águilas
citando
in
para el día
Obregon.
23 de mayo en la
And
idea
this
de que
is
ahí
inviting you to a
ocurrirá una
party on
fiesta
May
COVID
23rd, and
cuyo
there's going to be a
propósito es
COVID party
buscar
there.
contagiarse,
And that is where
además
people
de
want
gozar
to
del
get
ánimo de
infected,
diversión y el consumo de
and they
bebidas
want to have
alcohólicas.
fun and get drunk while they're
Que
getting
quede muy
infected.
claro,
And I want to be
no
very
tenemos,
clear
o yo no
about
tengo
this.
documentación de dónde puede ser el
I
origen de
don't know
este audio,
where
si es
this
genuino o
audio
no, si
recording comes
realmente se
from.
está
I don't know
pretendiendo
if
hacer
it's
esta fiesta
authentic.
o no,
I
pero
don't know if
esto
this
nos parece
party
un
is real or
despropósito.
not, but this
No
is just
es un
ridiculous.
mecanismo
This is
adecuado
not
para
an adequate
conducir
way
a inmunidad en
to
importantísimos
get herd
riesgos, a
immunity. There are
pesar de que
so
podría ser que
many
solo personas
risks,
jóvenes
even if it's
concurrieran a
only
esta
young
hipotética
people.
fiesta.
If people
Entonces,
went to this
reprobamos
hypothetical
completamente este tipo de llamados,
party,
si es que
there would
son
be a lot of terrible
verídicos, si
consequences.
es que son
So if
falsos.
this
También
is true,
reprobamos
this
los
is just
ejercicios de
despicable,
deliberadas
and we are
desinformación, me
totally
parecen
against
sumamente
this. This
irresponsables y
information is
peligrosos.
completely
Y
dangerous and
no pretende el gobierno
irresponsible.
mexicano en modo
The
alguno, no tiene
Mexican
plan
government
alguno, nos
in
parece
any way has
completamente
zero plan,
absurdo
zero
pensar que
plan. This is totally
deliberadamente
absurd.
puede
And it
provocar
seems crazy that
infecciones
people
como un
would
mecanismo de
deliberately try
alcanzar la
to
inmunidad.
infect
Eso
other
es un
people to get
recurso que no
immunity.
está contemplado, no
This
creo que
is
ningún país lo
just has
esté
nothing to do with
intentando de esa
our
manera,
country
definitivamente
or
no
any other
el
country. No
gobierno
one is
nuestro.
trying to do
Mañana vamos a
this.
explicar el
And I want to
concepto
be
de
clear that the
inmunidad de
Mexican
rebaño que se ha
government is
comentado
not
aquí, pero para
is
evitar
not part of this in
imprecisiones
any way.
y que no se
And we'll talk to you
distorsione su
more about
interpretación
this tomorrow.
en ese sentido.
We'll tell
Rápidamente
you all about it
contesto
tomorrow. Let
las
me
fechas.
answer some other quick
Estos, de
questions. Oh,
acuerdo al
the
informe que nos
dates.
comparte la
The
Secretaría de Relaciones
report that
Exteriores, es
we get
desde
from
que
the
empezó la epidemia
Secretary of,
en
of
alguna
Foreign
parte del mundo, digamos desde
Affairs,
el inicio del año
we got
hasta
this
el 11 de mayo.
information that goes from the
Y las
beginning of the
otras,
year
de
to
acuerdo
May
con la prensa.
11th. And the other questions I will
Sí,
turn over to
en
Dr. Alomia.
relación comentaba las fechas de los resultados
With
por
regard to
laboratorio.
the dates
Sí,
for the
estas
lab
son
results,
variables porque recordemos
these
que
are
no
variable.
estuvo
We
realizando
must
procesos
remember
precisamente de
that there
valoración y
is
en su momento
a
emitiendo
valuation
los
process,
reconocimientos a los
and we
laboratorios
have
que
to
podían llevar a
recognize the
cabo. Entonces
labs
estas
who
fechas
can do
fueron
the
incrementándose más o
tests.
menos este
So
proceso
those
inició ya
dates,
hace un mes y
well,
medio.
the
Sin
process
embargo,
started about a month
fueron
and a half
pocos
ago.
primero los laboratorios y
And
eso
then
también
at
tenía que
first there
ver
were
con la
few labs who were doing
disponibilidad de
testing
kits
because they didn't have
comerciales
kits
que los
available,
laboratorios
commercial
pueden
kits for
adquirir
testing.
directamente en el mercado nacional o
So
internacional.
those
Estos kits fueron
they were
aumentando
waiting to
prácticamente en los
acquire
últimos
those
dos,
kits
tres
from the
semanas. Había
international market.
mucha
So after two or
disponibilidad de
three
estos kits.
weeks,
De
they
hecho,
did receive them,
el
and now
mismo
there's quite a bit
INRE
of
ha
availability.
evaluado prácticamente ya más de 30 de
And
estos kits de
we have
diferentes
seen that
marcas, de diferentes
over 30 kits have been
formulaciones.
tested to
Entonces,
see
ahora
if
que
they are
incrementó también la
okay and if they
disponibilidad
are
de este tipo de
in good
insumos
working
y
order.
haber
And now that
avanzado
we
en
have taken a
la
look at those
valoración y el
materials, we can
reconocimiento de estos
see
laboratorios,
that
ya desde
we
hace
can
12
preview
días
which
más o
labs
menos
are
son
available to be
41
using
los
those
laboratorios
tests. Now
que
we
han
have
tenido este
41 labs
reconocimiento y que
who are
además varios de ellos
recognized
son
and
redes o cadenas
certified
nacionales que en
as
su
being
momento
able
operan en
to do
diferentes
those
estados. Entonces
tests.
digamos que ha
And
sido un
these
aumento
are
gradual.
in a number of
La
different
mayor
states.
cantidad de estos
So now
resultados
we have
definitivamente se
more
concentran
results,
en los
yes, of
últimos
course,
15
and they're
20 días.
concentrated over the last
Previos a esa
15 to 20
información
days
realmente
because
eran
before
todavía
then
pocos porque eran
we had
menos los
few labs
laboratorios
that were
reconocidos y eran
accredited
menos la
for doing
disponibilidad de
those
insumos en el
tests, and
mercado nacional.
fewer tests were available to our national market.
Bueno, no hay en sí un estudio, por lo menos
We
yo no
don't
me ha
have a
tocado verlo, dado
study,
que no
at
es
least
un
I haven't
grupo que haya
seen it,
sido ampliamente estudiado, a
but
diferencia de
there
los
is
casos
a group that
confirmados.
really hasn't
De
been
hecho, todavía hay
studied
mucha
that
incertidumbre,
much.
aún en
So
los
there's a lot of
países en los que
uncertainty
ya
about
han pasado la
which
epidemia,
countries have
de
passed
poder estimar
through
la
the apex
cantidad, por
of the
ejemplo,
pandemic.
de
And
personas
so if they can give us an
portadoras
idea of
o
how many people are
asintomáticas que
carriers or
den
how many
positivo
people
al
are
virus y que
asymptomatic,
nunca
how many people
desarrollaron
are positive
sintomatología.
in
Todavía
their
no hay,
country.
inclusive, por ejemplo,
we still don't have that information. We still don't have a big study about the prevalence of how many people there are. Surely over the next few weeks and months, while other countries start to invest human resources, financial resources into understanding how many people are infected, and they will be able to do more research, then we'll have more information about that. Thank you, Dulce Soto.
Buenas noches.
Good evening.
Gracias. Doctor Gatell,
Thank you.
sé que ya nos
Dr.
presentó
Gattel,
las cifras sobre las
you
muertes de
did
neumonías no
show us
especificadas y
the
también de
information on
enfermedades
deaths from
respiratorias,
non-specified
por
pneumonia
enfermedades
and
respiratorias
respiratory
agudas graves, pero
diseases
los datos de las enfermedades
on
respiratorias estaban hasta
severe
2019.
acute
Sé que
respiratory
también nos
infections, but
indicó
I
que
saw
el
that that was
INEGI
information from
sigue evaluando
2019.
esas
I
cifras
know
para
that
poder hacer el
INEGI is
reporte.
still looking at
Sin
that
embargo, pudo
information to be able to
adelantarnos
report on it.
datos de las
But
muertes
could
por
you give us
neumonías no
information
especificadas
on
hasta abril
deaths
de
from
2020. En
non-specified
ese
pneumonias
sentido,
until
quiero
April
preguntarle
2020?
si sería
I
posible
want
que
to
nos
ask you if it
presente
would be
las
possible for you
cifras
to
de las
present
muertes por
that
enfermedades
information
respiratorias
on
agudas
deaths
graves
from
en lo que va
severe
de
acute
2020
respiratory
también, si nos las
infections
podría
for
presentar en
all
esta
of
conferencia,
2020.
por
Could you
favor.
present that to us in
Si
this
podría tener
conference?
esos datos.
Yes,
Y la siguiente
yes.
pregunta
And
es
my
que
next
el
question
CONACYT
is,
informó que para el 15 de
the
mayo
Council
iban a
for
tener
Science and
listos
Technology
unos
told us
ventiladores
that we were
que
going
estaban
to be
reparando y en los
receiving
que estaban
ventilators that were
trabajando.
being
Quiero
repaired and
preguntarle si
worked
tienen
on. I want
información
to ask you
de
if you
cómo
have
va el avance
information
de estos
about
ventiladores
how
y
that's
a qué
going,
instituciones se
with the
distribuirían, por
ventilators,
favor.
and
Muchas
which
gracias, Dulce, por su
institutions will
pregunta.
be distributing those.
De la primera, con
Thank you
mucho
very
gusto
much,
traemos,
Dulce, for your
preparamos la
question.
información. De hecho, lo que presentamos el
Yes,
sábado pasado
we will get you that
precisamente
information.
incluye
On
el
last
primer
Saturday,
trimestre
we presented the
o
first
cuatrimestre hasta el
trimester
corte
or
de abril de
first
la información
4-part
preliminar
semester on
sobre las
preliminary
muertes, en
information
este caso
on
sobre
deaths.
este tema, de
In
este
this
síndrome,
case,
aún por
with the
codificar,
syndrome that
que es
you
infección
were
respiratoria aguda
referring
grave o
to,
neumonías no especificadas
severe acute
concretamente.
respiratory
Y
infections or
estos tenemos
non-specified pneumonia.
cortes mensuales de
And we
información,
have
cada
monthly
mes tenemos
cuts
un
for
bloque nuevo
information.
de
We have a
información
new block of
que
information each month.
proviene de los certificados de
This
defunción.
comes
Son
from death
mecanismos
certificates,
considerablemente
and this
veloz
is a pretty
de concentración de los certificados de
speedy
defunción y de
process for death
información a un
certificates. We get
sistema
the
de vigilancia
information
epidemiológica que se estableció
almost right
desde
away. It's entered
1995, que se llama Sistema Epidemiológico
into the
Estadístico de
epidemiological
Defunciones.
monitoring system that
Y
we've had in
por el
place
otro lado
since
tenemos
1995.
información sobre las muertes
On the
que
other hand,
también
information about
deseablemente debe estar
deaths
acompañada de los
that
certificados de defunción y de un
that on
componente
the
del
death
certificado de defunción
certificates we
que es el
see
anexo 8.
that
El
they have
certificado
an
de
annex
defunción
number
es un
8 on
documento
it. So
oficial
there's a death certificate that's
bueno, por
official.
algunos conocido, que
And some
tiene
people know
4
this
copias y
certificate. It
tiene
has 4
una
copies.
sola página
It has
en tamaño
one
oficio, pero
page
después hay
on
anexos
an
que tienen un
official
propósito
size of paper.
que establece
And
el INEGI
the
como
aim of
autoridad
this is
nacional
for
en materia de
INEGI, as the
estadísticas vitales,
national
y el
authority for
anexo
vital
8 es para
statistics, to
rectificar
have
o
information
ratificar
there. And
los
Annex
elementos
8
de juicio sobre la sospecha
ratifies
diagnóstica
if
de lo que
there's
la
a
persona
suspect
certificante,
diagnosis
habitualmente una
from the
persona
person, the
profesionista de la salud,
certifying doctor, usually a health professional,
pone como causas de
and
muerte.
that person
Pero lo que
puts the
presenté, de
cause of
hecho,
death
es
there. So what I presented today, but I'm interested in information on the
cuando
severe
llegue el
acute
bloque de mayo, el
respiratory
que
infections
presentamos
rate
fue
up
hasta abril.
to April
Cuando llegue el
2020.
bloque de
Well,
mayo,
we presented up to
es el que
April.
presenté, pero lo volvemos
Oh,
a
yes,
traer,
that's the
sin
one I
problema.
presented, but I'll bring it to you again. No problem. Well, that's because you
Ah,
were
de las
talking
demás,
about pneumonia. I want to know
perdón,
about
no
all
recuerdo
the
bien.
severe acute respiratory
Lo retomamos con
infections,
mucho
not just
gusto.
pneumonia.
Y sobre los
We'll
ventiladores,
get that
no
ready
tengo
for
en este
you.
momento la
And on the
información
ventilators, I
actualizada,
don't
pero
have
a las
that
8
updated
tenemos la
information
reunión de
for you.
seguimiento.
At 8 o'clock,
Con
we
el
have the
presidente,
follow-up
cuando vemos
meeting
el
with the
trabajo,
president
hacemos
and our work
esto
group.
2 o 3 veces a la semana
And we
y
do that 2 or
aprovecho y
3
lo
times
pregunto y
per week.
mañana se los
And I
contesto.
will take advantage
Por
today.
aquí otro de algo más,
I'll
no,
use the
son las
opportunity to ask him.
19:59
I'm sorry,
minutos.
it's
Pues quedan
7:59.
pendientes para mañana,
So
igual
we'll
usted.
hear your
Y
questions
nos vemos
tomorrow,
mañana.
you,
Muchas gracias.
and we'll see you
Buenas noches.
tomorrow. Thank you very much. Good night. Good evening.